the thing to know about when you first start taking these medications is they take about 2 to 3 weeks to kick in. They are not magic. They are not magic. I just left my psychiatrist's office and I started remembering how it was for me when I first started seeing a psychiatrist. It wasn't this one, it was another one. And the terror that I felt about having to take psychiatric medication, because I always have wanted to just deal with things in a very, very natural way. My personal work history is actually made up of teaching relaxation techniques, meditation workshops. I'm a hypnotherapist. I've done massage therapy, name it. I've even done something called EFT tapping. And so that's what I was doing for the first 6 months when I was having panic attacks that were resembling epileptic seizures. I ended up in the emergency room 3 times in the middle of the night. And so when it came time for me to actually go and see a psychiatrist, because my therapist had suggested that maybe that's what's necessary, I was so resistant to start taking this medication because I saw it as a failure. I saw it as a failure on my part of being able to heal myself, being able to use all the natural resources that are available to heal myself, until I landed with that first psychiatrist. And may he rest in peace. He broke down for me that medication is what you need when you're in crisis. And for what my body and my nervous system had been doing, I was in crisis. And he's like, sometimes a crisis can last 6 months, and sometimes a crisis can last 10 years. I was like, what? I'm always forgetting to introduce myself. My name is Melanie, and welcome to my channel where I talk about issues to deal with mental and emotional health, mostly for women over 40 or over 50 years old. And I do a lot of content on menopause also. So I'm going to go into talking about what it's like to take psychiatric medication. But before I do that, I want to go back and talk about what my therapist explained to me about this whole thing of being in crisis. She explained to me that because I had had a lot of abuse in my childhood that I hadn't fully dealt with, it had now reawakened itself on a different level when I was in menopause. So that's how she explained to me that, listen, depending on how long you have been dealing with trauma and not dealing with it at the same time, that will sort of determine how long your quote unquote crisis will go on for. So let's go back to the medication now. How do you know if you need medication? You don't. You don't know. You actually need a doctor's advice on that. Now, I am very well aware that in other countries, especially as a Black woman, people may want to over-medicate you, but I live in Jamaica, and thank goodness, I really have to thank goodness that I have yet to meet a psychiatrist that wants to over-medicate me. So I'm saying all of this, keeping all of that in mind. So please keep in mind that everything that I'm going to be sharing here is from my personal experience and from talking with my doctors. By the time you have ended up in a psychiatrist's office, for most people, you are feeling like you're suffering. You can't handle whatever's going on with you. And so you sort of cave in and say, yes, I want to take medication. So the first thing I want to cover is what you can kind of expect when you first start taking medication. Usually it will be medications within 3 ranges if you're dealing with depression, anxiety, or like in my case, CPTSD. So you'll usually have an antidepressant, an anti-anxiety medication, and or a mood stabilizer. And for many women, one of the prevailing issues will also be insomnia. So one of those medications will probably also help you to sleep. The thing to know about when you first start taking these medications is they take about 2 to 3 weeks to kick in. They are not magic. They are not magic. And for those 2 or 3 weeks, because you're actually taking the medication, your expectations are pretty high. And so when you feel like it's not working in that 2 to 3 week period, you will need a lot of support to comfort you and to sort of soothe you while you wait. But I can almost guarantee you that if you're actually on the right medications, right after that 2 to 3 week period, you will begin to feel a great deal of ease of whatever your symptoms are. One of the reasons I'm reminded of this so strongly today is that 2.5 to 3 weeks ago, I had to have an adjustment on my medication. I've been on medication for a while, and we keep trying to reduce some or whatever, but I had a very horrific triggering experience, and so I needed to have my medication adjusted. And let me tell you, even though I've been through it so many times, I did not remember that it really takes 3 weeks or 2 to 3 weeks for it to kick in. And by the time I had gone to my doctor today, I had actually covered the 2.5 weeks, and I've been feeling a lot better. And so when I went in, and I was saying to him, listen, these 2.5 weeks, I completely forgot that I need to wait. So it was very hard to go through the 3 weeks. And we sort of smiled and said, yes, it is. So no matter how many times or how long you've been on medication, because I've been on medication for a couple of years, every time you adjust your dosage, your brain chemistry takes a while to adjust to it and for it to quote unquote kick in. So anyway, that's I think the most important thing that I wanted to say about it, about taking medication if you've never taken psychiatric medication before. The other thing that I wanted to say now, okay, if you are in a place and you feel like you've gone to a psychiatrist and they have over-medicated you, this is where the internet and other doctors can come in very handy. Because if you have a GP or even a friend who graduated med school or somebody who you can show your prescription to say, does this look like too much? You can get some advice that way, because for every medication that you're given online, it will show you how much would be too much of that medication. And so this is where you sort of have to advocate for yourself and be pretty wise about what you're doing, which is difficult when you're, not feeling very good, but it's just necessary. Or you can have someone in your life who you trust do the research for you. So let's say you feel like the dosage is too much. Do not attempt to change what you are taking on your own. You actually need to go back to that psychiatrist and ask them to explain why the dosages are as they are. Why? Because especially if it's not just one medication, medications, especially psychiatric medications, are sort of pooled together to work together. So there may be a reason for where you are right now that one medication seems to be over the prescribed dosage. I can't make a warning strong enough. Do not change your dosage on your own without checking with the doctor. It is very, very important that you don't do that. If you go back and the doctor is still not agreeing with you, then unfortunately or fortunately, you'll need to go and find another psychiatrist who you feel will give you the dosage at the level that you want, but still don't change it on your own. A lot of people who are against psychiatric meds, always bring up the point that psychiatric medication does not cure depression, nor does it cure anxiety. And they are not wrong. However, there is a time when you do need medication to help you control an illness. Just the way that if somebody is diabetic, they may need to take insulin. Is that taking of the insulin curing their diabetes? No. It's going to come down to their lifestyle choices. So what psychiatric medications actually do is bring you back up to a level where you can sort of manage some more what's going on in your life. And I highly advocate that if you're actually taking psychiatric medications, you also need to go to therapy, because that's going to help. And between the two things, the best outcome is for you to be able to make changes in your life, make more healthy choices in your relationships, make more healthy choices in your diet, make more healthy choices in all the areas of your life. That's the purpose of it. So no, it doesn't cure it. They're right when they say that. But if you are actually at a point where you need the medication to cope with life in just a general way, then you should take it. That's my opinion anyway. So before I pull into my driveway, let me leave you with this thought. If you know that you're going through a time of deep depression, definitely try natural remedies first. But if they are not working and you are literally suffering, then please consider going to see a doctor and take the stigma and shame away if you need to see a psychiatrist. There's nothing to be ashamed of. It means you're struggling and you need help, and you can go get the help and feel better and be more of all that you are here to be in your life. If you've gotten to this point, thanks for watching. Please remember to like the video and subscribe. And if you want to just add to the discussion, then please leave a comment below. Take care, and I really wish you the best on your mental health journey.